Good morning, dear students. We start our classes today. Please type me in chat if technically everything normal. Do you see a screen? Our presentation. And we start. Yes, okay. I see 42 students in our classroom and 300 students on your flow. And I understand that only 10% students learning, 10% students want to receive a credit. It's not good, but it's your decision. Okay, our ethical issues. I give answer to my ethical issues. Yes, and today we talk about medical ethics. Yeah. And we have to lecture today with I think it will be 2 breaks between our part of lectures, because our term not huge, our topic not huge, and we try to tell something to different issues in bioethics. And today we start from the Hippocratic oath. Yeah? And Hippocrates, you may hear this, familiar. It's great scientific, you see, philosopher and physician. On a slide you see this, and it's our ancient area of history when we have not big kind of scientific discipline, not many branch of this. And in my previous lecture I see some writing in blackboard. You may see this, our math work in this laboratory or classroom, or some and I think about this, that in modern scientific situation we see a different type of knowledge, and this knowledge deep inside on very strong to understanding things. And in Asian area it realized in only some fields of knowledge, and philosophy and medicine, it's maybe same. And in this time you see that Hippocrates, he's known as the father of modern medicine. What it means? In this time, medicine as a branch of knowledge doesn't be in our practice. Yeah. It was not clear to understand, but we try to help to another people with some words, some herbs and another mystically action. Yeah? And Hippocrates stay on a position when we divide, separate our discipline from religion at first. Yeah? Because in this time, if one person have any disease, it's everyone understands that it's a problem with relationship between this person and a god, something like that. And when we divide this branch of knowledge, we understand that we have some factors as a reason of some kind of disease. Yeah? And you see in slide, it's factors of environmental, diet, habits. Yeah? And Hippocrates think about this and try to invite this knowledge in practice. And one of this, you understand that medical achievement in this time doesn't come in our practice, yeah. And but one document take part in our education now. Yeah? It's Hippocratic Earth. Yeah? You see an original document, yeah, of this earth. Yeah? And in this document, Hippocrates describes the basic ethics and principles laid down of a moral code of conduct for doctors. Yeah? And in our university, when we will took your diploma in the final of your education, all students in your flow come in our meeting action room, and we read this document. Yeah. Today you see a very growth of medical knowledge, but this principle described in this yellow page in Asian area take place in our working, our mansion. Yeah? You see a similar translate and variant of this document, and we may read this, and we try to divide this document on some goals, on some mentions, and try to discuss what happens in contemporary medicine, why we must think about this. Yeah? You see that it's a message to our history and some god, the Apollo physician, Asclepius, yeah? Gigea, Panacea, and all gods and goddesses. Yeah, Apollo, Asclepius, and you see it's historic facts. Yeah, you see it's Asclepius. Yeah, Apollo, it's Olympic gods. Yeah, classic Greek and Roman religion, god of health. Yeah, light, sun. It's associated with this god. And Asclepius, not me more. Famously known gods. You see staff, yeah, and snake entwined on this staff, yeah, and you see this symbol on a flag of the World Health Organization. Yeah, I think all of us hear about this organization because all new news on, for example, coronavirus. We wait the official document of this organization. What happens? What all our medical communities think about this. This organization relate all these questions. And you see this symbol on a flag of World Health Organization. It's history. It's one of element of Greece religion. Yeah. It's a symbol of medicine in contemporary world. Yeah. Okay, one it may be a huge definition. In short, we see a first principle. You may write this. First principle, including Hippocrates oath. Yeah, it's principle of solidarity with teachers and other physicians. It's a first and important principle of our practice. Yeah. Two parts of this principle: solidarity with teachers and with other physicians. And what it means? Our professional, one of element of this profession. No, for example, I think I show you this classroom, and in some fields of education, it's normally in IT specialists, for example, yeah, IT technology. Today, our city is one of famous region of these fields. We have an international IT company in Ulyanovsk. You may hear about this, and we have a very high level of education in IT technology. And specialists in this field think normally when they stay at home and learning by distant form, try to write some code in PC, and it's normal to in education in this specialist. Yeah. And specialists may see some YouTube video in her field, some YouTube channel, but what it's may be realized in medicine or no? It's the questions, the open questions. Our previous 2 years show that we must try it, but we stay head to head with problem, face to face. We see this problem. Yeah, now I demonstrate this. Very high growth of account of students in our classes. 54 students today see my lecture, and from 300 students in our flow. And we have a problem when we try to push our opinion, our approach to education from your colleagues, yeah, in not only, I understand it's maybe first course, yeah, bioethics first course. I have students on a 3rd course and 5th course, and it's the same situation. students have a problem with organization, her distant form of education. We must see very powerful motivation to this process, and one of big motivation in medicine, it's people. In medicine, it realized in a situation when you see a very sick person with pain, with serious health problem, you took some knowledge from your mind, do some action, and see healthy people. When young specialists feel this motivation, it's very good to find new information, a very good stimul to find new information in environmental count of this information. And in this process, we doesn't search this information only in internet, only in book, only in practice. Not practice, only in books, YouTube channel, some information resource. Yeah. When we start a practice, when we start learning some kind of diseases, we frequently may read some expectation of diseases. When we may hope that it's maybe a traditional form of this disease. Yeah. And in practice, we see very huge deviation of standard symptoms of disease. And only in contemporary situation, very growth, IT technology, artificial intelligence, we doesn't see good working program any supported from our practice when we realize this principle in IT. Yeah. We traditionally learning by teachers, learning by learning under a specialist, young doctor and doctor with good practice. Yeah. And its approach from many years, because our body, our diseases very differently, and it consists from some genetic aspect of this individualist, this person, yeah, and some variant of anatomy. Yeah, in my practice, I see very frequently a very different kind of vascular anatomy of a brain. For example, it's problem when a patient reads something in this examination, yeah, of MRI tomography of a brain, and see that it's maybe problem, yeah, 3 vessels on the middle artery of a brain, and it's a variant of norm. It's her individual norm, and we must discuss this. Yeah, and in this principle, at first part, we must be solidarity with teachers. Yeah. At another part, it's solidarity with other medicals, other physicians. Yeah. At first, and doctors. it's one of problem of communication, because when we see not simple situation with disease from this patient, and see a previous consultation of another physicians, at first we think about himself as a great physician, yeah, with a brain flow from I, and I'm very clever, smart, and very high level of my education, and we sometimes I see this phrase that it's doctor not be very good, it's not right diagnosis, this treatment not good, yeah, and it's we must be solidarity with other physician, and we may discuss this problem, but this discussing may influence by doctors and doctors, yeah? It's colleagues, it's field to discuss, and in practice in our country we realize this principle in лечебная комиссия, ЛКК in Russian, it's some medical commission, yeah? When in it's traditional meeting from a doctor one time a week. In all hospital in our country we have, and this ЛКК, yeah? In Russian, yeah? Лечебная комиссия, лечебная клиническая комиссия, medical clinical commission, yeah, and in this commission include one doctor of apartment, yeah, and sometimes it's a chief of apartment, and one doctor from a cases, yeah, in her practice, pathanatomy doctor, yeah, who introduce all news of this case, yeah, it's not good situation, yeah, in practice. And doctor discuss this case and try to understand what goes not right in this process, why we have mistakes, why we have a problem, why this patient was die. Yeah? And it's normally when we discuss in our field our position, and it's good form. And traditionally in classic work we doesn't meet our colleagues more frequently. Our practice include one cabinet for wall, one chair, and in your cabinet come different people with some health problem, and we discuss your opinion with this not specialist, but today it's not simple, yeah, because we have the internet and all our patients read this diseases, her symptom in internet, and have some opinion when we come to our cabinet. He was her opinion, and doctor have different opinion, and it's a hard process to contact with this patient. And in this practice we doesn't include some words that it's a not right diagnosis in your previous consultation. Doctor was have mistakes, yeah, it's not right. It's principle of solidarity, and when we feel this emotion when we feel a mistake of another doctors. We want to discuss this, yeah, and say this on your patient, said that I am very clever, I help you, but say of your mind, stop, and because one reason of this. And in our practice, one interactively, yeah, type in chat, please, what you think about the percent of mistakes on doctor practice. Yeah? How many mistakes in percent we produce in our practice? In World Medicine, it's a document of World Health Organization. Yeah, you may read this report in 2018, 19. Yes, you may search this. Type in chat what you think. How many percent of mistakes in our practice? Some gap in translation, or all students sleep in the another side of my screen. I see first hypothesis 10%. Okay. Keval Patel. Yeah. 15%. Yeah. %. We have a different position, 10 or 1/2. Ten percent. I see assumption. Yeah. Okay. In we come to medicine. Yeah, we start to 15-20%. Yeah. In document of World Health Organization, where yeah, the grades of increased, yeah, 20%, yeah, 40%. It's same one half of our disease is not right, of our diagnosis not right, of our treatment not right. Yeah, yeah, 45 maybe 40%. 40%. Yeah, one half of our, yeah. Arhinov Misha. Yeah, it's right. 40. And when we see mistakes in different consultation, you must think that in this place, statistically, we stay on this position in 1 to second part. Yeah, if 20 people come to your consultation, statistically 10 of this may be more greater, may be better in practice. Yeah, and I hope you feel this emotion, yeah, and try to think more wider in this situation, yeah, and will be solidarity of another colleagues, yeah. You see original message, yeah. I will apply dietic measures of the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice. Yeah, it's principle of beneficency to do good or avoid evil. Yeah, principle of beneficency. You hear on this principle in previous lecture, and different part of this principle of non-maleficence, yeah, toward principles, yeah. Primum non nocere, or do not harm, yeah, it's Latin primum non nocere, прежде всего не навреди, по-русски, да, не навреди, да, primum non nocere. In Latin you have this this classes of Latin language, and you see this definition, yeah, this principle. And next principle include in this phrase principle of justice in medicine, and we tell on this scope of this principle in our previous lecture, yeah. Next part of Hippocratic oath, yeah. A deadly drug to anybody who asks for it. In medicine, I tell about this in previous lecture, yeah, about euthanasia. It's one problem of this, yeah, and you see that a Hippocrates in ancient area introduced this problem in our field of medicine, yeah. Yeah, and in this phrase you see similarly, I will not give to a woman an abortive remedy. Yeah, it's principle of not to assist suicide or abortion, and principle respect of human life. Yeah. In one topic of our huge course, it's abortion, yeah, and it's problem area. We may have ethical problem in this fields, and if we think about career of gynecology, yeah, it's actually for you, yeah, not to assist suicide. It's one of ethic problem. In our classes we discuss this case. You may find this in United Kingdom, in a small city. One doctor practice many years, and in her practice account more over than 100 cases when this doctor give some deadly drug from her older patient, and it's a good case to think our position in medicine. In this situation, this doctor may think that I am a god in my territory. I take decision. I am take decision. What kind of days continually for these people? Yeah. Okay. Respect to human life. It's principle of Hippocratic oath. Next. We talk about this in previous lecture, and this principle it's importantly in our discussing today. Look on this, it's interesting. I will guard my life and my art. Yeah, and its principle of self-improvement. Principle of self-improvement. Physicians always must be honest, calm, understanding, and serious. Yeah? And it's a process of your not learning, not education. It's process of your life. And traditionally, in auditory, I ask questions who have parents in medicine or any relatives in medicine, and I see 10-20% of students, and I understand that only 80% of students come in medicine and doesn't understand what happened with her life, what kind of position of your profession take place in your life. Yeah? My mother is a doctor. My uncle is a doctor. Yeah? And in my childhood, I see many books in our house, and I see mother after hard working at night emergency services. Yeah, I remember how I want to read some books. We lay on a bed with my mother, and she started to read and turn on to sleep for 2 minutes ago. Yeah, I feel some not feeling in this situation, but today I understand. I stay on this position with my family, and you must think about this because our profession not simple, and it invite in all branch of your living, family, your friends, your hobby, all of this take impact on your professional. And it's a decision. It must be a mentioned decision. You must think about this because at first course we must grow this feeling in your mind, grows this feeling. When we search some information, when we understand something of your professional, at first you must feel a good emotion on this process, because today we doesn't understand this. We stay in the first step of medicine, but principle of self-improvement. We подкрепляем, да, sustain this progress of knowledge by emotion. Yeah? If we understand something not simple to understanding, some fact, your visuality some anatomy structure, and you understand how this work, how this organized, you must feel a good emotion. Yeah? It's interest. It's one kind of happiness and interest. It's one of plus emotion, one kind of plus emotion, and if we doesn't feel this, your professional growth stop very quickly. When we took a diploma, we think, oh yes, finish. I am finished. Not, dear students. We only start this process of your education when we took your diploma in 6 years ago from this time. You only start this process. And it's exercise from 6 years. The goal of this growth in your mind, feeling. When we understand some hard knowledge, we must feel good emotion, because you understand that its knowledge help us to treat some diseases, yeah, to save some life, for example. And it's a process, and it's a main principle to understanding in this time, in your time, in first step in education. If we try to learn and doesn't feel this, if we have questions in your mind, why I learned this, why this all information in my telephone, one touching screen and answer of various type of questions, and you introduce this skills in your practice. I see this. I see a telephone put on a leg and scrolling and answer and read Wikipedia in auditory. It's not a process in education. You may ask a questions by himself what I am doing this process. Search more interested for you if we feel this. Because all of your life influenced by this process. Yeah, we stay at home, we want to rest after hard working, we want to sleep, we want to play with your children, we want to speak with your relatives. And in the backside of your mind, we see any medical problem, any cases, any situation when we describe some treatments and write on this or no, yeah, and it's process in your mind. And if you're not ready to eat, yeah, if we doesn't want to work by heart all time of your living, all your professional life, we doesn't be a good doctor, because we may push himself 1 year, 2 year, 6 year from a diploma, and what in the future? What's the next? When we stay in your cabinet alone, and when we see a patient, we're not an artist. I understand in one theater theater представление, да, one episode, yeah. I sit in rooms, yeah, on theater, and see an actor on a stage and understand that it's a very hard profession, because every on this class see mistakes, yeah, when we have a mistakes in your speech, yeah, in artist. And what happened in medicine, yeah, we speech something and it's word, it's only word, and our mistakes, we have these mistakes in one half of episode, but on answer on this mistake we come not yet very frequently, yeah, because we all structure understand this. Okay, let's go. It's very emotional principle me, because I see this pain in my working when I see students in classes, yeah, when I see 20% of students who come to lecture, yeah, in this year. I have a lecture from second course, and I open my cabinet in YouTube cabinet. I wait my students, and from 60 students from two group, on lecture come only one person. And I ask this question, what I am doing in this place, why I sit on this place, yeah. I feel very good emotion when I have a practice, when I have opportunity to achieve any problem of my patients, yeah, and it's a point to thinking. Okay, let's read another principle in our practice. It's some another side of problem, yeah. Yeah, you see original form there. I will not use a knife, not even to saffires from stone, but will withdraw in favor of such mean as engaged in this work. Yeah. In a simple variant, it principle mean to leave surgery to surgeries. Yeah. Qualified aid for the patient. Yeah. To leave surgery to surgeries. It's a fly word from Latin, yeah, in our practice. How we realized this principle in our working, yeah. At first, when a doctor very have a good knowledge, have a huge field of interest in her profession, and see some problem from a different part of medicine, and we have at first a good feeling to help these people, yeah, to help this patient. And our principle mean that we must leave this problem to specialists in this field. Yeah. We must say that it's a problem of different area. I understand what happened, but you must come to specialist, and he realize the treatment of your problem. Yeah. To leave surgery to surgeries. Yeah. Okay. Next, principle in original form you see in slide, this definition, yeah. I will come for the benefit of the sick, remaining free of all intentional injustice. Yeah. In a simple principle, not to harm, especially not to seduce patients. Yeah. It's maybe understandably, yeah, we not to seduce our patients. Okay. Next type of Hippocratic oath you see in slide. Yeah? In our cabinet, we hear about some aspect of life, some habits, some problems, some family situation of our patient, some intimate problem, yeah, and all of this must be stored in our cabinet, yeah. Principle, you know this in principle bioethics, maintain confidentiality and never to gossip. Yeah. Traditionally, we want to discuss some interesting cases in practice, and we may do this, but we may think on confidentiality and doesn't open personal information of the patient in this situation. Yeah, it's main principle in your practice. We talked about this in previous lecture. Yeah. If we think the Hippocratic Oath, it's an ancient document, yeah, we update this information in the World Medicine Association Declaration of Geneva, the physician and pledge. Yeah. You see a same definition in this document, yeah. There's a same principle, yeah, of solidarity, non-maleficence, yeah, beneficency, no, not use not use any knowledge to violate the arm of our patient, yeah, make these promises, yeah, and another same principle of medical practice, yeah. Okay, some duties of a doctor, yeah, some duties on our practice, yeah, knowledge, skills, and performance, yeah. Make the care of your patient your first concern. Yeah. In I plus some definition in this time, in this moment, yeah. Because it's frequently when we have some hard cases in practice, and after that we come to this case and think about this in different visual form, yeah. It's skills to concentrate on a nature, on a case, and try to help from these people in this time. Yeah? provide a good standard of practice and care, yeah, and our field of practice, medicine, and traditionally it's education field. It's very conservative area, yeah. And when we see a new approach in medicine, we have a huge problem to introduce in practice this knowledge, yeah. And in your practice, it's one kind of working, yeah, when we provide new standard on your practice, because not simple when doctor stay in her position and do something like this variant, and you in position of chief of department say that it's a different approach, we must work by another way. It's not simple, yeah. Keep your professional knowledge and skills up to date, yeah, principle of in self-improvement. Yeah. Recognize and work within the limits of your competence. Its principle mean one aspect of our defense mechanism of our practice, because one problem of doctor is a burnout syndrome, and when we understand that our opportunity limited, and you may tell about this, that we may learning by bioethics in kind form, looking some film, and in this duties of doctor you may see a film Doctor Stranger, with Kimberbeach in main role, yeah, from the case of a very high educated, clever, smart neurosurgery who stay in position when we see her limits. Yeah? And all this, when we have a hard problem, we search some mystically, some another way to find an answer of this. And Dr. Kimberbeach in this film demonstrate this duties of a doctor, yeah? Because when we think that we must work in all situation very good, it's not right thinking, yeah, because it's a way to burnout syndrome, yeah. Safety and quality, yeah, principle. All your actions of patients must be placed to compromise. Yeah? Yeah, protect and promote the health of patient and the public. Yeah, it's important duties of a doctor. We frequently we doesn't like work in this area. Yeah, I come in my cabinet, I work with my patient, and it's always my profession. Yeah? In previous previous weekend, in previous weekend, I was contact with my friend, and in one time they call me at the night and say that I am sorry, I have a problem with my mother. I hope it's not right, but I think it's a stroke. Yeah, you are a neurologist. Say me some words what I must doing. Yeah, I try to help in this situation. Yeah, and when I ask questions how what happens with her mother, yeah, and it was a stroke, really hemorrhage stroke, and my friend, it's intelligence, old man, yeah, and he asked that why I doesn't know that arterial hypertension it's a problem. Why I doesn't know about this in my time of living. I think that medicine must be learning in a school because they feel a huge acute pain from her mother from this situation. Yeah, and it's cases one example why we must work in this area. Yeah, it's our duties. We must introduce our knowledge in society, and it's one reason why I start to work in social media. Yeah, first my account when it's mentioned action, yeah, in Instagram I start to post some problem only in this principle, yeah, because I understand the problem of postmodern society when we doesn't read paper, when we doesn't see a TV, when we hear only some person in her environmental, in her tunnel, yeah, in social media, and we find and separate this personality, yeah, and in our country, COVID demonstrate this problem, demonstrate because some famous artists think that vaccinated it's not good because it's a problem from my personality, my right of my personality. Yeah, why I must do this? Yeah, and many people in society like this artist, for example, some celebrity, and think traditionally on this paradigm. And where in displaced medicine, yeah, we doesn't have a position in social media, in social mining, or what happened in medicine. Yeah, we doesn't see this push of information in our practice. Yeah, it's duties, but it's another type of working. Yeah, when we demonstrate our principle, we may not distribute more this information. Some cases I tell about a simple position. When we have a social contact, we may push some variant, some right variant from medicine in this situation. Yeah. Now, one another example. My friend, we was meeting in 5 years, maybe old, yeah, 6. until we stay in school, yeah. And he said in one time that her father had problem with arterial hypertension, yeah. And in these duties, I try to push my opinion in this situation, yeah, and it's our duties, yeah. And I understand this at the first step, and I have some problem to this because my friend uh, think that my father is old man. What's the problem? It's not big problem, but in my position, it's problem with arterial hypertension with the risk of cardiac attack and stroke. And I am push my opinion in this situation and my duties. Yeah, next duties. Yeah, communication, partnership, and teamwork. Yeah, it's let's go to the first. Treat patient as individuals and respect their dignity. Yeah. Treat not, it's flight word from Russian, it's same in English. Try to treat not diseases, try to treat person, yeah? Individuals. It's not simple when we have some diet in practice. We must find all good definition in this situation. Yeah, I have some phrase, some framework from a different type of patients. Yeah, from IT specialist, I tell from some technique device, some example of the problem. From teachers, I try to explore same definition to her profession. Yeah. And it's not simple. It's in practice we collect this framework. Yeah. Respect the next. Respect patient right to confidentiality. We tell about this. Yeah. Work in partnership with patients. It's simple to hear, to understand, but very hard to realize this principle. Work in partnership. Yeah. Because in our situation today, we see that we decrease our position in society of a doctor, yeah, because very frequently we see information that doctor have mistakes, that's a reason of death of pregnant woman, death from a medical errors, yeah. And when a doctor save a life of people, it's normal case. It's your working. You have a salary from this. It's your working only. Yeah. And when we have mistakes, it's very good case to grow this problem in society, and all papers on all internet research repost these cases. Yeah. And what in the baseline? Yeah, partnership with patients is a skills when we communicated and realized principle of compliance, yeah, or rapport when we patients and doctors come in a partnership, yeah, to do some action in the way of health living, yeah. Give patients the information they want or need in a way they can understand. Yeah. Yeah, in previous lecture I tell these some skills we may ask questions. Do you want to know all information from your diseases? It not be simple to your mind. We are ready to contact with bad news in your life. We may ask this. Yeah. And in these cases, we must think about quality of need information, yeah, because on this information, patient take a decision what they will be do in this situation, yeah. Respect patients' rights to reach decisions with your about your treatment and care. Yeah, it's understandably all our diagnosis, all our treatment, all action, that alternative action we must discuss. Yeah? And it's our duties. Yeah, we tell about this. Support patients in caring of themselves to improve and maintain their health. Yeah, it's understandably. Yeah. The next it's principle, yeah, important. Yeah, work with colleges in the ways that best serve patients' interests. Yeah. In our practice, we in medical psychology course, we examine some case in our city, yeah, when a very famous doctor see do a operation, yeah, and endovascular, no, endoscopy operation of abdominal, and see some problem, yeah, and in small time they understand about mistakes of her nurses, yeah, and this principle tell us that we must work with colleagues to the best patient interests. And in this situation, doctor work with colleagues and state in the best interest of a colleague, not of a patient. Yeah, and they try to save a reputation of these nurses. Yeah, and try to minimize her result of these mistakes, and as a result this patient was die, a young woman with children and family, and it's a very famous situation in our city, and it's one case to think about these duties. Yeah, work with colleagues, but the main interest is the interest of our patients. Yeah, and the final duties of a doctor. Yeah, maintaining trust. Yeah, and it's the same definition. Yeah, be honest and open, and act with integrity. never discriminate any interest of patients or colleagues, yeah. Maintain trust in situation, yeah. Never abuse your patients. Public or professional, it's the same, yeah. Sometimes it's not directly abuse, but it's some definition, yeah, some paraphrase in practice when we include in speech to try to abuse our patient because they doesn't understand what you mean, doesn't say some words that I think that it's not right definition. What you do with my health. Very frequently we see and understand this, and in position of very frequently pattern position we tell about this on our classes, yeah, when it's position of a patient, it is position of a doctor. It's a very good position from our mind. But when we think about any abusing, yeah, we must growth and balance this position on one side, yeah, on one level. Yeah. It's disposition by Eric Byrne. Yeah, Eric Byrne. You may read about this. It's popular, two popular books. Я не знаю, как по-английски. You may find this Eric Byrne. Find in English variant. Yeah. Eric Byrne. Yeah. Люди, которые играют в игры, игры, в которые играют люди. It's a Russian variant of name of her two famous book when he described this level of function. Yeah. Okay. We must have a break in our practice. Yeah. And after I think 20 minutes, yeah, I doesn't stop our translation, yeah, and we doesn't limit in a time, and we start in 50 minute of a 10, yeah, 20-minute break. few minutes we start. We must continue. I copy my presentation and we start. Okay, and we we have some little time to speak from different uh, different частная, да, narrow questions in bioethics. Yeah? We in previous time we was talk about common questions in bioethics, and I remember that you know about the definition of bioethic, about the historic fact of bioethic, about the three group of reasons of born of bioethic. Yeah, we talk something like principle and rules of bioethic, and today we start our lecture on Hippocratic Oath. Yeah, a main principle on this document. Yeah. And in the next step, we used our time to discuss some narrow questions in bioethics. And main bigger problem is abortion. Yeah? And traditionally, abortion associated with infanticide. Yeah, and abortional, it's a predation. Abortion, it's artificial miscarriage. Yeah, artificial termination of pregnancy. Yeah? And what the ethical main ethical questions when we main ethical questions of abortion, why we discuss these two. Yeah? We see a 9 months of development, embryo development, yeah, on pregnancy. And in trimester, yeah, and you see some picture from this infant, yeah, in the body. You see weight line. It's a very important period in pregnancy, yeah? And in this time you see that it's a large of infant, yeah, and you see that in this time we doesn't understand what the time when we said that it's a question, yeah, when the questions of the status of a human embryo, yeah, complex bioethical problem, yeah. When we said that on this time this infant is a person. The main questions in this problem. And when if we think that in this week this infant is a person, is our citizen, we may introduce all lower rights of this person. Yeah? And when we stop the development of this person, yeah, it's mean that we kill this person. And it's questions of embryo status. Yeah, embryo status. It's the same situation in transplantation, да? embryos are classified as organs in our country. Yeah? We may took some cells on this organ and transplant it in another tissues in another bodies, and in our practice, for example, we see famous episode when we try to treat Parkinson disease with embryo cells. Yeah, and for example, we need to collect over 300 embryo organs, embryo brains, embryo cells, 300, to create one surgery operation from a Parkinson disease. Yeah, you understand the huge problem in this area. 300 embryon materials. Yeah. Okay. And when we must create legal norm, yeah, to this organ, to this infant, yeah. In some period of developing, yeah, in legacy norm, children are not full-fledged citizens until they reach the age of majority, when they acquire the full range of civic rights and obligations. Yeah? And after the birth, this child doesn't have all rights to take decision. Yeah, and what we tell about infant, yeah, about pregnancy, yeah, it's questions. Yeah, and some legal norm. Yeah, it's from a legal point of view, in the legal options. Yeah, if the fetus is a person, it's extremely, you see this definition, extremely specific conditions. Yeah? It exists inside the body of another person, and as a rule cannot be the object of any direct action of the part of another person. Yeah? And what we may do in this situation. In constitution of any countries, the constitution based on the human rights to life. Yeah? In all constitution, in all country, in Russian constitution, we have we declare some rights of our citizen, of our country. Yeah? Rights to working, rights to living, rights to democracy, for example. And one right is the rights to continue life, rights to life. Yeah? And what's the next question on this? If we have a rights to life, the questions when this life start. And when we do some operation with embryo tissues, yeah, in medical research, for example, in extracorporeal pregnancy, yeah, we doesn't think about the status of these tissues. Yeah, we may think that it's not some living organism. Yeah, it's some embryo cells. yeah, but what about her rights? Yeah, it's questions. Yeah. Medical indication for termination of pregnancy. Yeah, especially in our countries. Yeah, we realized this termination. Yeah, we divide, and it's a question. Be importantly, the questions from our test. Yeah, what two kind of termination. Yeah, in one, it's from the mother's side and from the infant side. Yeah, from the mother's side, you see these cases, some diseases when we may do abortion from medical termination, yeah, medical point. Traumatic and congenital heart defects, yeah, when we have a risk in pregnancy, risk from life of woman, yeah. Leukemia, it's a very high risk of hemorrhage in pregnancy, yeah. Oncological disease, it's understandable, yeah. Active from tuberculosis, yeah. In one case we touch this problem, yeah. Syphilis, HIV infection, several mental illness, yeah. Шизофрения, эпилепсия, да, вот эти, this medical problem, yeah, when we have a risk about life of woman in this situation in pregnancy. Yeah. Rubella during pregnancy, be attentively, it's a serious problem because I pay attention to some world in this situation because when we was students, we have one serious case in practice in the same course in our university. One students with rubella come to her practice, yeah, come to practice in gynecology, yeah, and in a group, in student group, another student was pregnant, yeah, and in a finale, it's a reason of abortion, yeah, on medical termination, yeah? Because where the rubella infection during the pregnancy increased the risk of internal defect of internal organ very high. Diabetes, prolactinoma, yes, some problem in endocrinology, several pathologies of vital internal organ. Yeah, it's from its termination the reason of medical termination of pregnancy. Yeah. In our country, we have 3 types of abortion. You see in slide this 3 types. Yeah. At first, until 20 weeks of pregnancy, it's a request of the woman. It may be. Yeah. It's a request of the woman until 20 weeks of pregnancy. We have the second types of abortion for social reasons, yeah, until 22 weeks, yeah, 12, 22 weeks, social reasons, yeah. We tell about this. Yeah, and from medical reasons, all time of pregnancy. Yeah, 3 types of abortion. Yeah. Okay. Medical indication for termination of pregnancy. Yeah. We have another definition from the side of the fetus. Yeah. In gynecology, we examine frozen pregnancy, yeah, serious intrauterine malformation, any anatomy structural problem with uterine, yeah, with movement, and some chromosomal anomalies, yeah, some genetic problem with fetus, yeah. For example, very frequently it's a syndrome Downer. Okay, these 3 side from the fetus. That's 3 reason of termination of pregnancy. Yeah. It's a list of social indication of artificial termination of pregnancy. Yeah, in our country it's maybe in your laws it's maybe another. Yeah, in our country for understanding how this work. Yeah, you see in slide. Yeah. Some situation from disability. One to group, yeah, in the husband, yeah. Death of your husband during pregnancy, it's a social indication there, social reason, yeah. Stay of a woman or her husband in place of deprivation of liberty, yeah, on any prison, yeah. A woman or her husband unemployment, да, duly recognize unemployment. It may be in a medical hospital we have this practice, yeah, in our cathedral psychotherapy and psychiatric, yeah, we see this. Availability of court decision on deprivation of restriction of parental right. Yeah, no, it's the same from 4. Yeah, you see on 6, I pay attention to this, the unmarried woman. It's a social indication. Yeah, I'm smile on this reason, unmarried woman, and the reason of stop of pregnancy. What the objective reason I doesn't understand, but it's a reason. Yeah. Next reason, divorce during pregnancy. Pregnancy due to rape. Yeah. Some film of this reason, yeah. I see. Yeah. Большая маленькая ложь in Russian. Big little lie, maybe same on English. Yeah, it's a good Roman of USA and good serial, short serial on one of this type of problem. Yeah. Lack of housing, living in a hostel, in a previous apartment, some problem of living, yeah. And 9 point. Some migrant problem you see in slide, yeah. Large number of children, yeah, 3 and more, it's in our country's definition, yeah. Yeah, the presence of disabled children in the family, That's one of the reasons, yeah, because it children who have more time to care. Income per family members is less than the subsistence level set for this reason. It's small reason for me, yeah, because we have opportunity to do something to grow this level, yeah. And ethical problem on the abortion include this opportunity. In this slide, it's a slide from student slide to because you in this time of liberty, this your rights, yeah, and all in one side, all people may be engaging in sexual contact, but if people take this decision, yeah, we must think about responsible of the possible conception of a child. It's your duty. And the life of the embryo is not a price to pay for their mistakes. Yeah, think about this. Yeah. What status of embryo we doesn't know, but it's not money to pay from our mistakes. Yeah. And in other side, you see the next step of definition according to abortion advocates. Yeah, social contact does not automatically imply possible pregnancy. Yeah, and we if we have this instinct in our humanity, we may right to realize this and what happens in the result, we may have a mechanism to realized different approach on this situation. It's advocate position of abortion. And in our country, all gynecologists may have opportunity to give consent, do abortion or no. And in your country you may read this, and I know this example when doctor in our city doesn't do abortion in her practice, but it's a very frequently a problem in practice. Yeah. Okay, it's some aspect of abortion, especially in our full classes we discuss this problem, and frequently any students crying and this term, yeah, any students have acute contact with each other, yeah, because all position of advocate and not advocate of abortion have very serious reason to talk. Yeah. Okay, and it's a problem of abortion. Yeah, we discuss something. another we have how to introduce not big term from transplantation. Another topic, it's ethical issues of transplantation, very acute problem too. And 1 minute. Transplantology is a very rapidly developing area in our medicine, yeah? And create new ethical questions of society. And we doesn't find right answer in traditional culture to these ethical questions. Yeah, transplantology sent our this problem. Yeah. You see this problem of human organ transplantation. Yeah, ethical, legal questions in this area. How we realized this mechanism of donor organs and informed consent of transplantology to remove this organ. Yeah? And traditionally we have a three type of approach to organ donation. Yeah? Be attentively, it's a questions of our test. Yeah? Presumption of consent, presumption of disagreement, request consent. Three type. We observe all of this and try to think about this problem. Yeah. Presumption of consent. Yeah, you see country where realized this principle. In Russia too, we have a presumption of consent. Yeah. You see, that's flexible definition. Yeah? In highlight, yeah, lights. It's in any form, both in writing and orally. Yeah, and in lower questions we see a problem of this. Yeah? What the problem of presumption of consent? Yeah. If we see, we remember a case of Christian Bernard. Yeah, first transplantation in our history, yeah, transplantation of heart, have this problem, yeah. And potential donor, if this time to take decision come, we think that its body, if we constant death of a body, we have a criteria of death, and we may form a difference from Christian Bernard age of living. We have this criteria, and we may constant death And if this scope its rights of our government, and our society, and we may use this in organ transplantation if this person doesn't realize her rule to stop this operation, this action, in right form, in oral form, in family, friends speech, You see that it's a not good definition from lawyers, and in our country we have this problem. In 1990 we have a house in our government, in our society. We have a broken of structure of SSSR, the Soviet Union, and we start a history of Russian Federation. We have a house in all part of society and in medicine too. And some not educated government, military government, think that transplantation may be possible from money in our country, and they think that some rich people may pay by this operation. And I tell that it's not possible in all countries, in all situation. It's not possible in contemporary world because we have a huge structure to analyze совместимость, genetic aspect of a donor, of recipient, and some process. It's a huge structure. It not be realized in any underground hospital. And if we see this article in yellow page, we must know that it's a fake. It's a fake. Almost it's a fake. We doesn't have only one episode when in any country realized not как неправомерное, not laws on law transplantation of any organ. And our country have big problem of transplantation. This transplantation of heart, on liver, on kidney. I'm sorry. It's not from account of our country, of people in our country. It's very little percent. It's maybe gross, but we have this problem of this presumption of consent. You see another variant, the presumption of disagreement. And it realized in some countries, USA, Canada, France, Holland, Ukraine. In this situation, if the person's opinion is unknown, then it's considered that he was against donation, and this organ will not be removed. Okay. If I must write this my right in a law document, if I doesn't want to do some action with my organs after the potential episode of this. Yeah? And its approach opens some aspect. Yeah? And we have a serious growth of transplantation in Canada when we start a program to popularize transplantation in this country. Yeah? And some social media activity on this approach, some TV aspects, some social media, yeah, and I like phrase you why we need kidneys on honest. Yeah? It's situation when we declarate your disagreement from the some action. If we doesn't do this, we may transplantate this organ. Yeah? And the consent requested form. Before his death, the person clearly give permission to remove the organ. The request are written consent to the removal of the organ. In USA, for example, you can declare your decision to donate your organs after death, for example, yeah. And it's documented in a special driver license, yeah, point in driver license, and because it's a main reason, yeah, car accident, main reason to give some action with organs, yeah, if we see acute trauma, for example, from brain, yeah, and it's a material to transplantation in the future. Yeah? Priority problem. Who to choose the one who will be kept alive and who will be allowed to die? Okay? We touched this problem in the case of God Committee of Seattle. I hope you remember this. From artificial kidney function, yeah, apparatus of this function, and who must first, who next, who have chance to continue life, who no. It's a problem of organization, yeah, of transplantation, and some ethical aspect in the second point, yeah, what to take as a basis of choice, yeah, race, gender, nationality, social, economic status, what's the point of influence in this process, yeah, and yeah, who are more useful people for society, yeah. Remember our case from flu vaccine, yeah, it's one of approach useful people, yeah, and we save internally, we all of students very frequently save a doctor because potentially it may save another life, yeah, useful people. And who are not useful may come to another world. Yeah, it's open questions. Yeah, and we must think about this. Yeah? And in transplantation, we we see some another problem of blood group, rhesus factor, some genetic aspect, and any parameters of individual compatibility of patient's body, and on an organ. And today it's realized by chemotherapy, supported our immune states, and for example, in the transplantation of костный мозг, transplantation from leukemia, cancer of blood, and we may hear Tinkoff Bank in our country. Oleg Tinkoff, it's a famous entrepreneurship in our country, and they have this medical problem and see a huge problem in this area when they stay in position of hospital, from this disease, and he was come to treatment in United Kingdom, where this opportunity realized in a contemporary situation. It's a serious problem when we supported immune states in a zero, when we degrade this level of immune states, and we must clear all environmental, we must filter the system on filtration in this cabinet in this hospital. It doesn't see but doesn't do contact with another people. Many months it continue when we transplantate and transfuse some blood on this events. After that, Oleg Tinkoff start a committee to help these people with the same problem in our country, and raise of money from charity from this position. And it's one example how we may grow some problem in our society, and I'm very likely this situation when our great entrepreneurship look on medical problems and try to do something of this. Okay. And finally, I want to tell you some organization questions. In my break, I have a time to see your group in your portal. All of us may took your personal login and password to come this structure AEOs, and from some group I sent this information. From another students I will do this on this time on today. We have a test for February on Friday in 11 o'clock. We must start. We have enough time to working. We have simple questions. We doesn't worry from this. We only 50 students from 300 doesn't worry about this. Simple questions from our lecture, from our course, but the formulated of these questions, very limited variant to search information in internet. Yeah, I prepared this question on this side, this position. You may have a skills to think about questions. Yeah, and we may observe our material. Today I sent all material in your portal, and you may start. Yeah, because tomorrow we have a finale meeting of bioethics. Yeah, I think we talk about more interesting and important questions of medical students. Yeah, we talk about this in our tomorrow. We will talk about experimentation in medicine. Yeah, in medical education, in medicine in the common. Yeah, okay. I think it's all material to our meeting today. I hope that it's interesting. Yeah, thank you for your attention. At evening you may see in